I'm just going to be taking notes as we go through so I don't miss anything. Okay, and how long has that pain been ongoing for? 3 months. Oh dear. Okay. Have you noticed any kind of sinus pressure or any kind of blockage at all in your passageways? Okay. Bit of head pressure, okay. Do you suffer with migraines or headaches? Okay. No, we can certainly give that a listen to, that's fine. And you mentioned you've had a bit of a cough. Is that like a chesty heavy cough, or is it more like a sharp sensation? Okay. Oh, you poor thing. So sorry, lovely. Well, we will get it sorted for you, so don't worry. Okay, what I'm gonna do is just have a listen to you. So put my stethoscope to your chest, and I'm just gonna be listening in. If you can take deep breaths for me, so fill up all the way, inhale through your nose, and then gently exhale very smoothly. Alright. Okay. So the stethoscope might be a bit cold, I'm sorry. If you can just take deep breaths in through your nose and hold for 1 to 2 seconds, and then gently and softly exhale for me, that will allow me to listen really closely, okay? So when you're ready, just take a nice deep big breath in for me, please. That's it. That's it. And out. Good. And in again for me, please. And out. And in again for me, please. And out. And in again. And out. Okay. And one more. And out. Very good. Okay. Okay. Would you mind if I had a listen in on your back as well? Yeah, perfect. That's lovely, thank you. So just the same thing again. Deep breath in for me. And out. And in. And out. And in for me. And out. And in. And out. And in. And out. Good. And in once more. And out. Very good. Can you just cough for me? Okay, and if you can just cough for me again, please. Okay. Alright. That's very good. Yeah, so I am hearing a little slight bit of fluid on your chest there. It doesn't sound too alarming, but it's still there and it will need to be treated, so we can get you something for that. With your cough, have you noticed any other kind of symptoms? Any runny nose, sore throat, fever at all? No? Okay. That's good. That's good. It doesn't sound like the flu, but we will just need to monitor it to be on the safe side. Are you allergic to anything at all? Not that you know of, okay? Brilliant. Fantastic. I'm just going to put on some gloves and have a quick check of your eyes, ears and mouth. Is that right? Yeah. Brilliant. Okay. look at your mouth. So if you can just open your mouth for me. Oh yeah, we're not the dentist, but I just want to check your tonsils at the back of your mouth. Okay, so just open your mouth. Ah, that's it. Great teeth. Great teeth. That's it. Keep it wide open for me. Lovely. Okay. 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 I just want to have a little look with the light in your mouth. So just once more for me, can you open wide? Yes, please. Thank you. Okay. 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 It is looking a little bit red inside. You're not having any pain whatsoever. Okay, that's good. But yeah, it's looking a little bit inflamed at the back of your throat where your tonsils are. Am I okay to just check your eyes? Yeah. So I'll need you to just concentrate on the wall above my shoulder. And if you could just keep your stare there for me, please. I'm just going to come with the light, okay? That's it. Good. Very good. Good. Okay. And now just the other eye. So again, if you can look at the wall behind my shoulder. That's it. Good. Good. Very good. Good. Okay. Good. And could you just turn your head to the side for me? I'm just going to check in your ears. Thank you. Okay. Good. And the other way for me. Thank you. Good. Good. Yeah, nothing to worry about there, so that's great. Okay, that's the physical examination complete. I just want to ask you some lifestyle questions now, is that alright? Perfect. Just pop them in the bin. It smells incredible, this one. Lovely. Okay, so just getting on to the lifestyle questions. How is your diet at the moment? Yeah, you're getting a full balanced healthy diet. So enough protein, enough fruits and veg. Yeah, good. That's what we like to hear. Okay, and you're consuming enough water as well. Yeah, good. Diet is imperative, especially when it comes to recovery, because your body literally needs calories to fight off infection. So just make sure that you maintain your diet and you make sure that you're getting enough calories, enough healthy fats and carbs and protein. Good. Water. Personally, I say to drink between 2 to 4 litres a day. If you can drink 2 litres, that's brilliant, but if you can drink more than that, that's even better. Okay. Wonderful. Okay. And what about your fitness? Are you physically active? Good. Oh, brilliant. What exercise do you do? Nice. Nice. I love swimming because it works the whole body. Yeah, excellent. Keep that up, that's good stuff. And just moving on those kind of hours, you know, they can disturb the natural rhythm of the body, so it can result in slight stress. Yeah. Okay. Yeah. I mean, working, earning money is good, but if it's coming at the cost of your health, then you will definitely need to kind of reevaluate things. Maybe for the next few weeks, just cut back on the overtime and just work your normal scheduled hours, because full-time hours, you know, is still a significant amount of time to work. Is it a physical job that you do? Is it labourers? Okay, yeah. So I will definitely be advising that you cut back on the overtime. Yeah. Is that alright? Yeah. Good. Good, because I would absolutely hate to see you any worse. Alright, and it's important to look after yourself, don't push yourself too much. So, as your work life, your home life, do you have good relationships around you? Do you have support from family and friends? Good. Okay. Right. Oh, I'm sorry to hear that. I can imagine that must be really tough. Yeah. Yeah. I always say to my patients that having the connection there and the warmth there from family and friends is so important, not just to your mental health, but to your physical health as well. Just as much as diet and exercises. So do try and spend as much time as you can with your family and friends, and just be around that warmth. It works wonders for your body and your soul, but your body especially. Yeah. What about hobbies? Do you have anything that you can enjoy just for yourself? Oh, nice. That's really nice. I love that. I love that. Yeah. You should definitely get back into that, because wow, that must be so much fun. Yeah. Oh, okay. Oh, I see. Yeah. Oh, bless you. Yeah. Laughing is the best medicine. There's a reason why that became a saying, because laughing is absolutely phenomenal. I used to work at the hospital, and the rate I would see people recover when their spirits were high and when they were laughing was just incredible. So I always tell people, laughter is the best medicine. Stick on a comedy, get laughing, or go around that one friend that's just super funny and that just makes you laugh. Yeah, it's good. It feels good to laugh. You said you're not allergic to anything that you know of. Okay. Have you had antibiotics before? Okay, perfect. So that shouldn't be a problem. These antibiotics that I'm going to prescribe to you are completely natural. I try to prescribe natural as much as I can, and these antibiotics are absolutely fantastic. They will be sure to clear up any mucus that's on your chest at the moment. They are a 10-day course, so what I want you to do is I'll prescribe them for you today, and if you could take your first one this evening with your evening Yes, just sign there for me, please. That's it, perfect. And I'll just put my signature on there too. And today's date is the 17th. Perfect. So, that prescription you can collect from the pharmacy just next door. They're really, really nice in there, and they should get that ready for you straight away. That's for you. Within the medicine, there's obviously an information leaflet, but the pharmacy will also print a label on the side, and the label will give you clear instructions. Take one a day. Each tablet is 200 milligrams, and there's a 10-day supply there. So you just take one a day and make sure you take it with food. So after breakfast, after lunch, or after dinner will be absolutely perfect, alright? Oh, you're most welcome. And if I could see you on the 28th as well, let me just see actually whilst you're here if I can book you in. And then we can do a check over, make sure you're all perfect and in good health again. Okay. 28. I've got 4 o'clock on the 28th. Would that suit? Yeah, sure. Let me just see if I've got anything earlier. I can do 10:15 on the 28th. Yeah, brilliant. I'll just book that in for you now. And what I'll do, I'll make sure all of our notes as well are saved onto your record, so when you come back we can go through everything we've touched on today, and yeah, make sure we get you back to full health. Was there anything else at all that you would like to speak to me about before you go? No? Okay, brilliant. Well, just make sure to keep on with your good diet and your exercise. Make sure to get enough you time. Think about slowing down with work a little bit on the overtime hours, because you don't want to pour too much time into your work life and not have any time for you or your home life. So just watch that and consider reducing the hours. I definitely would. And I will see you in 10 days time. You're not going away at all, are you, on holiday? Or no? Good. Just want to check, because obviously you can't have any alcohol with the medicine,